Thank you, everyone, and it's a great pleasure to be at this meeting. My name is Godfrey Sama. As I was introduced, I'm working with the College of Surgeons of East Central and Southern Africa, but also the RCSI under the collaboration program. So I'll be taking you through this program that we have been taking. We have been implementing under the COSEXA RCSI collaboration program. And I think the main basis, I would be following up what Johnson has said. The global burden of surgical diseases is such a high. You will be surprised that it is billions of people. But we look into various levels from when they seek care, when they reach care, do they have access to surgical care? And even when they now go out of surgical care and they want to rehabilitate, do they have those care, but also all the catastrophic impacts that they face after their surgical care. And we see that.
You can continue.
Okay, so we see that out of these 5 billion people, more than 90% are in the low and middle income countries, as we can see from the map here, but also majority of our population in low and middle income countries are in the rural settings, so more than 50%. But also, as we are talking about achieving sustainable development goals, surgical care is such a neglected stepchild of global health. So I think it's an opportunity for us to speak it here in this meeting, where majority of our speeches maybe will be highlighted into HIV. But we see that there is this neglected stepchild. But a little bit of an introduction to follow up the morning session. COSEXA and RCSI have been working together to improve the access to surgical care. And the main reason was that numbers of surgeons were significantly low, around 0.56 per 1,000 populations. So this is what have been done, but one of the challenges that you have the training sites, which are mostly located in semi-urban and urban settings. But as we conclude again, most of our surgical training will take a minimum of 5 years. So there is a huge potential, there is a huge need to continue improving quality of care of people, especially in the rural settings. And this is what motivated us to now work and implement the Essential Surgical Training Program, which mainly looked into addressing surgical care in the rural settings. So maybe this one will be one of the videos that was recorded in 2015. This was in Rwanda, and the goal is that the majority of the people in the district level didn't have access to surgical care. And the publication which came earlier just for building capacity, but also making sure that there is an access to timely, but we also tackle the obstacles to achieve access to care. So this is the call that was called, that there is a huge need in the district levels, but then we always say that people in the rural settings are very hard to reach. Is it true? Is it that us in the medical colleges or medical universities, medical teaching hospitals are the ones who are very hard to reach? So as you can see, this is a long journey that people came from Rwanda in the Kigali and then go down. But this is the clinicians who have the expertise, but also they are supported by a number of vehicles, but look into the person who is in the rural setting. So that is the call that this publication looked into. It was a systematic review, just trying to say we need to address also building capacity, but also acting to addressing the obstacles that these people in the rural settings suffer as they access surgical care. So this came to our objective that we wanted to implement. It's not a new project, a new program. It was a WHO-based program. So we wanted to implement this in concurrent to the specialist training program that COSEXA is running. And the reason and the concept behind is that we should not leave anyone behind. Despite where they are, they should be able to access surgical care. So this project, the program has started many years ago, but we looked into how can we implement differently from the 2022-2024 period. So we went back and tried to do some qualitative interviews with experts who implemented in 2017-2019. From there, we got some information that informed us in terms of designing an implementation plan. We implemented this program from 2022-2024, and then we evaluated. So our evaluation was mainly based on the feedback from the experts, from the providers who went to do the training. What is pending is now we want to do the survey and survey the people who received this training. So some of the results only noted that this program is feasible, it was needed, it was useful, and it had a potential to improve outcomes of patients in those settings. But also some of the recommendation was that there should be a need for local leadership. External funding should also be to catalyze the effect, but if you are looking for sustainable gains, I think the local funding, local leadership, local resources mobilization should be highlighted. And also there was a need to incorporate technology. We are looking into a country, for example, of Rwanda, which is, we are able to do maybe a few trainings, but there is a huge people who can benefit from these trainings if we incorporate technology, and a number of programs that are already ongoing to highlight this. And prevention is something that we normally don't talk much, but I think it's something that we need to highlight. So this was our implementation plan. It was still based on the WHO surgical care at the district level, but we highlighted, okay, the project will be led from the COSEXA Secretariat, but the key implementers are the local people. So we worked closely with surgical societies, ministries of health, and also we made sure that they are somehow linked with the COSEXA program, so they know that the main idea is to build specialists, but still there is a need to improve quality of people who are not currently reached. And also we highlighted the use of technology. So one of the feedback was that the time was not enough. Most of this training was done in only 3 days. So highlighting some of the online resources, we directed some people to go through these online resources so that they can get more of the training using online resources and technology. So over the years, we have been able to implement in 6 countries, but from the 2022-2024, we have been implementing it in Tanzania, Kenya, Uganda, Rwanda, and Zambia. And so the 6 countries, but more than 317 people have been trained. But if you look into, since the program was incepted, so 6 countries received this training, and more than 1,000 providers received the training. So this is really significantly complement the training of COSEXA, which currently we have 910 people who have been trained. But if you complement the 1,000, I think it really brings care closer to the people. So the mode of delivery has not been changed, but we use theory-based, which is PowerPoint presentation and case scenarios. But there is a number of simulation, but also in an event where the training is happening, there is a potential case that people can learn from. So live simulation, live training in the OR do happen. But mostly some of the trainers will use either simulation models, which are inanimate, but also animal models. So these are the things that the providers themselves look into and say that these are needed, and they can improve quality of surgical care among those people in the rural settings. And in a summary, that the program has added significantly a number of people who are able to provide surgical care in the rural settings. And then the essential surgical training really has a potential to reduce these significant disparities, because people now in the rural settings, at least they're able to do some number of cases. We know of the bellwether procedures. So these are the key areas where people are training. But also, if they see a patient that they cannot train, they cannot treat them, knowing that they have to refer, I think that is also important. As I say, technology is quite important in making sure that we reach more people, because maybe more than 1,000 people can even be more than that, because these are the people that trainers had to go and reach physically. And then the sustainability will really depend on the leadership, local leadership and funding. And we are already seeing some of the countries like Tanzania, a number of clinicians have been able to uptake this kind of training. Actually, it is in pediatric surgery. They are uptaking this training, working with the Ministry of Health, and they are able to now sustain this program based on the need of the country. So I think this is what we wanted to say, and we acknowledge these multiple people who have been contributing to this work, from COSEXA, but also from the RCSI Institute of Global Surgery, and the surgical societies that we worked closely from these countries, but also significantly the funding from the Irish aid that made everything possible. So thank you so much, and I'm grateful for your attention. Thank you.